Hi, this is David Schaefer, the American Retirement Advisor. This segment is on how to choose a Medicare plan. If we look at original Medicare, it has two parts, Part A and Part B. Part A has no premium at this time. Part B has a premium, and if you're joining Medicare in 2012, it's going to be $99.90 or more depending on your income the previous year. After we've made the decision to accept Medicare Parts A and Parts B, the next choice is we need to decide if we're going to supplement our Medicare or transfer our Medicare benefits to a Medicare Advantage company. To look more closely at our choices, if you have benefits from work, either as an employee or a retiree, you may or may not be required to have Parts A and B of Medicare. Your company's outline of coverage will tell you exactly. Your next choice may be supplementing your Medicare benefits with a Medigap plan. That's what Medicare describes as a Medicare supplement. Your next option is to transfer or replace your Medicare benefits with a Medicare Advantage plan. In many areas, the benefits are extremely generous and cost-effective. The last option is for folks that qualify for Medicaid. In many cases, the states will partner with a Medicare Advantage company to take care of all of your medical concerns. Most folks will either supplement their Medicare benefits with a Medicare and Medigap plan or replace their Medicare benefits with a Medicare Advantage plan. As you can see, there are many companies that offer either Medigap or Medicare Advantage plans. These differ by state, county, and even zip code. But remember, Medicare supplements are federally standardized. They're exactly the same no matter which carrier offers the plan. Medicare Advantage plans are also exactly the same in terms of benefits, but your copays differ based on the plan. To compare and contrast Medicare supplements, that's Medicare with a Medigap plan, and Medicare Advantage plans, we really need to talk in generalities. It's been our experience over the years that most people are concerned with maintaining their current physician relationship. With Medicare and a Medicare supplement, this is not a concern. Medicare will pay any doctor or hospital with a license to practice medicine, regardless if they participate in Medicare or not. The Medigap plans, either F or G, will pay any charges over and above what Medicare allows, leaving you without any copay or deductible to be concerned about. With Medicare Advantage, you need to check directly the carrier's network prior to signing up with the plan to make sure you can maintain your relationship with your current physician. As for copays with the Medigap Plan F, that's Medicare and a Medicare Supplement or Medigap Plan F, there is no copay for any Medicare covered service. For Medicare Advantage plans, copays typically range from a low of $0 to as much as, say, $3,000 for a 10-day hospital stay, with copays for the doctor in the average range of $10 to $15 per visit. When it comes to deductibles, for Medicare with a Medicare Supplement Plan F, there is no deductible that you need to be concerned about. All is covered by the plan. With Medicare Advantage plans, you can expect to pay from a low of $0 to as much as 20% for any covered service that you may receive. As far as out-of-pocket costs, there are none for medical services covered with the Medicare and Medicare Supplement option. With Medicare Advantage plans, your out-of-pocket maximums could reach a federal limit of $6,700 on an annual basis. When we discuss prescriptions with the Medicare supplement, you need to purchase a separate Medicare Part D prescription drug plan. In most areas, there's 20 to 30 different plans to choose from, offering a great deal of choice. On the Medicare Advantage side, prescription drug benefits are typically included. As for the reasons why people pick certain columns, if you will, the Medicare supplements are typically selected because of freedom of choice. Use any doctor or hospital in the United States without restrictions. There's no copay or deductible for Medicare covered expenses, and you don't need a referral from your primary doctor to see a specialist. The reasons people select a Medicare Advantage plan is typically low monthly premiums or simplicity of use, and of course drug plans are usually included. As for calculating your total cost of your Medicare plans, the left column being Medicare and a supplement, and the right being a Medicare Advantage plan. Notice that Medicare Part A is still free, and Part B is based on several factors, primarily income. The premiums for a Medigap policy range on a number of factors, including male or female, smoker or non-smoker, and the zip code in which you live. This is a good average number to begin our illustration. Medicare Advantage premiums range from a rebate of as much as your full Medicare Part B premium to as much as $149 a month, depending on your zip code and the plan's availability. Part D of Medicare is the prescription drug benefit. The national average cost of a Medicare Part D plan is $35 a month. With Medicare Advantage plans, the drug programs are typically included, so there's no additional cost. To get a rough estimate of what these plans would cost you on a total monthly basis, the column on the left illustrates somewhere in the neighborhood of $265 a month total, and the right column illustrates somewhere in the neighborhood of $100 a month in total. Once again, this is David Schaefer, the American Retirement Advisor. I hope you found this video informative.